Good day, Dr. Aykut.
Thank you. Good day to you too.
It's very nice to see you.
Yeah, nice to see you again.
Can you tell me, please, about your experience in plastic surgery? How many plastic surgeries are you doing per year?
I got my education in Cerrahpaşa Medical School, and so I got my specialty in University of Kocaeli Medical School. I have my own clinic in Nişantaşı, Istanbul, for 4 years, and so we do all plastic surgery operations.
Can you tell me, please, about your favorite surgeries? What are surgeries that you are doing the best?
Yeah, okay. Normally, I try to do all surgery best, but I like to do liposuction, facelifting procedure, and mommy makeover procedures.
Regarding the Mommy Makeover, when this surgery is recommended for after giving birth, and what is this surgery?
Yeah, okay. So we do mommy makeover procedures, women after birth, and so actually it depends on breastfeeding. If the breastfeeding is continue on, after breastfeeding over, approximately 6 months later, we can do the mommy makeover procedures. If there's no breastfeeding after birth, 6 to 8 months later, we can do mommy makeover procedures.
And which surgery does mommy makeover include?
So in mommy makeover procedures, related to breastfeeding, we can have some problem with our breast. And also related to pregnancy on tummy region, the patient can have some saggy skin on tummy area. And primarily, actually, we do breast surgery and tummy tuck surgery, and including liposuction in mommy makeover.
And what are the restrictions after the surgery? For example, can the woman hold the baby, and in which period of time after the surgery?
So after each body procedures, we don't offer any patient to carry on heavy things, baby or another thing else, for 2 weeks, and 2 weeks later they are free. But for each surgeries, we have some restriction, especially for each procedures. For example, if we do body procedure, we don't want sunbath for 2 months, like that. Yeah.
Okay. Regarding the liposuction, I know that you are doing G-plasma. Can you tell, please, more what are advantages of G-plasma compared to the normal liposuction without G-plasma?
Okay, so J-plasma is a novel device. We add this procedure to liposuction. It's not liposuction technique, actually. It's a device we use for body after liposuction. Normally, we like to combine liposuction with VASER and J-plasma device. J-plasma using plasma energy with some gas, and so alternative electricity, and so it's helped us to make skin more tighten. So if we have any question that the patient will have some saggy skin after liposuction, we strongly recommend the patient to get J-plasma to make skin more tighten.
What is the effect of abdominoplasty, and when abdominoplasty is recommended like a monosurgery, and when abdominoplasty is recommended together with liposuction?
Yeah, normally liposuction, we focus on liposuction to harvest fat from fatty areas. But the patient has more saggy skin, the patient need to get tummy tuck procedure. If the patient doesn't have more fat under skin, the patient doesn't need to get liposuction procedure. All time we have fat under skin, also because if the patient want to get tummy tuck procedure, it means that the patient was overweight before, and so she has more fatty skin. So also the patient has more fatty skin and also saggy skin on tummy area. Generally, we combine the procedure with liposuction with tummy tuck, and with tummy tuck procedure, we only remove the skin, but to harvest fat, the patient needs to get liposuction.
So abdominoplasty is recommended for the patient who has lost the skin before, for example, with bariatric surgery, right?
Yes.
And liposuction is recommended with abdominoplasty if the patient still has skin to remove.
Yes, you're right. Yeah.
And what are the restrictions after the body surgeries after liposuction and tummy tuck? When the patient can get back to work, when he can start teaching?
So actually it's different in liposuction and tummy tuck procedure. In liposuction, 2 weeks restriction are enough for the patient, but for tummy tuck procedure, we generally make this muscle tightening procedure, muscle application. And so the patient will have also tightened skin on tummy region. When the patient walking, she has to bend forward a little bit. And also 3 weeks restriction would be better for the patient to return work or to return normal lifestyle.
And do you use some maybe tricks or some methods that make the surgery, tummy tuck, mamoplasty, facelifting more efficient, maybe less painful for the patient? Some special like tricks that maybe you use?
Okay, so for the pain, actually, we give strong medication for the patient. For the result, related to my experience, I exchange my tricks. Why? Because I always follow up the patient. And so I see what I do, what patients see 3 years later, maybe 4 years later. And so we have some tricks. For example, for belly button area, we try to do a hole a little bit smaller because it will be spread out by time, and so the exact result 3 years later will be natural. And also we try to give some definition on tummy area to help patient to see her own muscle appearance on there. And for the breast, we do more lifted overcorrection because by time related to gravity, breast will go down. And so in first year, patient can see her breast a little bit overcorrected, but 2 years, maybe 3 years later, she will see natural and good appearance.
You told that for the tummy tuck, you do very good definition.
Yes, so we get this by doing high definition liposuction. One will make the skin more thinner and our own muscle will be more visible.
To make like more sporty.
Yes, you're right.
Okay. And do you do this sport bellies?
Yes, I do. So actually we have two types in this technique. One is high definition liposuction. The other one is abs crack surgery or six-pack surgery. Normally, I don't like to do six-pack procedures or abs crack procedures because it's artificial. It's not the patient's own muscle. Instead of that, actually, I choose to do high definition liposuction. Means this, skin will be more thinner and all muscle will be more visible. So one is artificial, the other one is natural. I always like to do natural result.
Okay, and regarding the facelifting,
yes,
what is the result that we can expect? How many years the patients become younger after the facelifting?
Actually, it's difficult to answer how many years the patient will be more younger. So we try to do skin more lifted and more tightened. So she will have or he will have younger appearance. But how many years? It's a very difficult question to ask.
Approximately, like, of course, it's very...
So as my patients feedback, always they said 15 years.
And how long does this result last? Maybe the patient needs another lifting in 20 years or 5 years. How long the result last?
Normally, all procedures result is permanent. The patient gonna see the effects very long years, but our aging process all time continue on. So if the patient aging process will go faster, in 5 years, in 10 years, maybe she need to get another surgery or face again will be sagged down. If the aging process is lower, it's the patient will have this result more longer.
Maybe you have some advices how to extend to this aging process.
Okay.
Make it more long.
Yeah. Okay. The answer of this question is that exchanging lifestyle, more hydrating, sport activity, and eating well. So, exchanging lifestyle, and so eating well, sleeping well, drinking well, that's important.
I see. And sometimes you do full facelift, sometimes you do only one part facelift, upper or lower. How to decide which option is good? And maybe upper facelift sometimes is not enough. It doesn't give a good result. How you choose which approach is better for the patient?
Yeah. Okay, so we decide the surgery technique by patient's complaints and also with the problem. If the patient has problem on upper face, we do on the upper face. If on the mid face, we on the mid face. But actually, we can separate the technique with the age. On younger patients, we also do temple lifting, temporal approach, face lifting, or ponytail lifting. All is the same procedure actually. If the patient a little bit older, full face lifting all time is better.
I see. And where are the scars? Are the scars visible after the facelifting?
Yeah, okay. So in ponytail lifting, the scar will be in the hair and it will be totally invisible. But on the other surgery, yes, will be a little bit visible. Scar will be front of the ear and also on the back. So when the healing done, actually, it will be almost invisible. But in this time, approximately 3 months, maybe 6 months, it will be more visible.
The scar will be more visible.
And 6 months. And 6 months later, scar healing will be done totally. And so it will be approximately invisible.
I see. And what is the ponytail lifting? Could you tell a few words about this?
Yeah, ponytail lifting, there are many marketing names. Cat eye surgery, fox eye surgery, eyebrow lifting. All is the same actually. The patient will have incision inside the hair and approximately 2.5 centimeter. We do all surgeries from here. And so we focus on lifting eyebrow and also we focus on lifting mid-face. And also we try to do fox eye, cat eye surgery from these incisions.
Does give a natural view?
Yeah, natural and younger and attractive appearance.
And then I see. And we also know that sometimes something go in a different direction. And some patient need to have some advice, maybe some small revision. What is your action in this case if somebody needs support already after the surgery when the patient come back home?
Yeah, okay, so we have special team for following up the patient. And so all time we give the patient information what should be cared of. And so when the patient care of these issues, all time they will have good appearance and good result.
Thank you very much, Dr.
Okay, I thank you. And then so nice to see you again.